Hello, I'm Dr. Khalilah Jefferson, DNP. Today I want to share 5 things I wish I knew before becoming a nurse. These are not things you learn in textbooks. They're lessons that come from experience, reflection, and time in the profession. If you're a nursing student, a new nurse, or even a seasoned nurse, I hope this resonates. Number 1, being a good nurse will not protect you from burnout. I wish I had understood earlier that competence and dedication do not make you immune to exhaustion. In fact, high-performing nurses are often at greater risk because they take on more, care deeply, and push themselves harder. Burnout is not a personal failure. It is often a signal that the demands placed on you exceed the support provided. Knowing this earlier would have helped me set boundaries sooner and recognize when systems, not individuals, needed to change. Number 2, communication matters as much as clinical skill. I entered nursing focused on doing things right, getting the skills right, following protocols, and being precise. What I learned is that patient outcomes are often shaped by communication, how clearly information is exchanged, how concerns are raised, and how confidently nurses speak up. Being technically correct is not enough if your voice isn't heard. Learning how to communicate effectively, respectfully, and assertively is just as critical as clinical knowledge. Number 3, nursing culture affects you more than you expect. I wish I had known how deeply unit culture influences confidence, performance, and well-being. Supportive environments help nurses grow. Fear-based or dismissive environments quietly erode confidence and morale. Culture shapes whether nurses ask questions, report concerns, or feel safe admitting uncertainty. Understanding this earlier would have helped me recognize that struggling in a toxic environment does not mean you are a bad nurse. Number 4, you will carry emotional weight home with you. Nursing is emotionally demanding in ways that are not always visible. You carry patient stories, family grief, moral dilemmas, and moments you wish you could change. I wish I had known earlier that emotional processing is part of professional responsibility, not a weakness. Learning how to decompress, reflect, and seek support is essential for long-term sustainability in nursing. Number 5, leadership starts long before a title. I used to think leadership was something that came later, after experience, after promotion, after permission. What I learned is that leadership shows up in everyday behavior. How you advocate for patients, support colleagues, handle conflict, and uphold standards. Every nurse influences their environment. Recognizing this earlier would have empowered me to lead with intention from the very beginning. These are the things I wish I knew before becoming a nurse. They don't make the profession easier, but they make it more honest, more sustainable, and more human. Thank you for listening.